At TVC News, wherever the big news story is happening, we're geared up to break it. TVC News, first with breaking news.
Good morning, everyone, and welcome. I am Nifemi Oguntoye. Very troubling how fast the numbers, the COVID-19 cases are rising in Nigeria. We're told by the Nigeria Center for Disease Control that 1,670 new cases were reported overnight, taking the country's total now to 112,004. Lagos recorded the highest number with new cases up to 776, followed by Kaduna with 147 and Kwara with 131 new cases. And the Federal Capital Territory recording 102 new cases. Perhaps the good news is that 89,000 out of these numbers have been discharged. Unfortunately, 1,444 people have died based on COVID-19 complications. But let's turn our attention to the schools. Lagos, Ogun, and some other states resumed on the 18th of January. A few other states have decided to keep the schools shut for now. But how did we fare, especially in Lagos? I'm joined by the Nigeria Union of Teachers Chairman, Lagos State Wing, Mr. Adeshino Adedoyin. Good morning and thank you for finding time to come.
Good morning.
So what the papers are reporting this morning is partial compliance. You know, our correspondent was out yesterday with the Commissioner for Education. We're going to play a report shortly. But we are told that in some places there was compliance, but not across board. What is your evaluation of resumption yesterday?
Thank you very much. Because in Nigeria Union of Teachers, we are not only a trade union, but a professional organization. We too, we have our own monitoring team, which I decided to lead, to monitor randomly across the state yesterday. In some places, we have a total compliance. In some places, in few places, we have a partial compliance.
Okay. What would you say is responsible? Because before now, there was what they call the school readiness template released by the Federal Ministry of Education. And there were things that schools were supposed to have, you know, to aid compliance. What was the situation prior to 18th of January?
Now, I remember last time when we want to resume after the first wave, many things were put in place. Hand-based machine, washing hand basin, talk of a hand-based sanitizer, soap, and every other thing. Even face masks were provided. You see, because of the little time that that thing was relaxed. So many people are very relaxed. But you find out that after the Yuletide, we had the scourge rising very high because people have traveled here and there. So back to the issue of the one in the school. Yesterday was the first day of resumption. The compliance in terms of water, all this thing, it is not in that aspect, but it's in the aspect of the students and some pupils that some nonchalant parents did not even provide the face masks to them.
Okay, so I understand that you mentioned that there were infrastructures put in place during the first wave.
Yeah.
Are those structures still on ground across board in all of the schools?
They are on ground.
And all of our schools have water?
They have water. We have water.
To wash
because
hands.
We too, as I've told you, we have our officer that we have asked to go around the schools to take notes, what is on ground in this school, across the local government.
All right, let's say things for ourselves. Our correspondent Sharon Jackson, in company of the Commissioner for Education, visited certain schools yesterday to monitor the level of compliance. We'll see that report now and we'll be back.
Lagos, Nigeria, following government's go-ahead that schools can resume. Some students were seen on their way to school, but many were not wearing their face mask, neither were they practicing social distancing. Though the turnout of students for resumption for the new term is low, most schools reopened for academic activities. I met with some parents in Lagos who remain skeptical about school resumption. They say they might reconsider whether their wards should continue schooling.
if they know that there is still COVID, it's better for the student to stay at home. So I'm even thinking of how I will stop my children from coming to school tomorrow. Different type of children will come. People that travel abroad, travel to different states, they will come back to the school and join together. So that's when I'm afraid. When they're at home, nothing, no problem.
We want to trust that it's okay, but deep down, I would have preferred that the children are asked to stay back until a time when we're sure that it's being contained. I'm sure they can do more monitoring, come to the schools to ensure that, these guidelines are being followed by the schools. And I'm sure there's so much more they can do.
During inspection tour by the State Commissioner for Education, some schools were seen to be compliant with COVID-19 safety protocols.
We are visiting private schools. In fact, let me tell you, I have more than 50 teams on the road. They are just following me. The PS has a team following her. All the directors in the ministry are out. The QA, quality assurance, all of them are out. So there's hardly any school today that we will not touch. We can't stop everything. If we don't allow them to come, then children won't go to school. So they are rostered. They will not come every day. You see, she said that Chief will do their test tomorrow and Shine. On the day our Chief is here, the Shine teachers will not come. On the day Shine is here, the Chief teachers will not come. So that's we'll roster them. That's the.
While schools in Edo and Anambra State will resume in February, those in Lagos, Ogun, Osun, Ebonyi, and others reopened for academic activities on Monday, 18th of January. Though professional bodies such as NMA and NUT have made reservations towards resumption of school activities across the country, they insist that strict adherence to COVID-19 guidelines as released by NCDC has to be adhered to ensure that the spread of COVID-19 is reduced to the barest minimum. Sharon Ijason, TVC News, Lagos.
Okay, let's talk about staggered learning, what you call shift system. How does that currently operate during resumption now?
For secondary school, because of the external examination that the SS3 are going to write, all SS3 will be coming Monday through Friday.
Okay.
For SS2, Tuesdays and Thursday of the week. Therefore, SS1, Monday, Wednesday, and Friday. Then for primary school, we have what we call active and shine. They have to spend 2.5 days in the school. The active will come 2 days, the shine will come 2 days. Then the two will have half a day on Fridays.
Okay, so all of this is an attempt to ensure that the classes are not overcrowded. But how do you now ensure accelerated learning, given the fact that the students already have wasted some time, in the previous, just before now?
Yeah, you see, you can't run beyond the level of your faith. You know that. So it is what we have that we are going to use to make sure that we put all our efforts in educating or imparting knowledge to those children. For instance, in primary school now, the Lagos State has done something which we acknowledge. The core subjects, like in mathematics, English, basic science and technology, and social studies, all those things have been done into MP3. The children will be putting it on, and they will be rehearsing it, they will be hearing the way that lesson is being presented. Okay. Even when you ask them, when you give them those songs of our artists, they can sing it from the bottom to the top. So it's just like when they are doing that, when they are hearing it, they'll be rehearsing it, it will be in their memory. So by the time they come to the classroom, the little one, they start to teach them. When they go to that, they will remember that I've had this thing.
Has there been any form of virtual learning situation where students can interact with teachers without physically being in the classroom?
We did that one during the first wave. Okay. Whereby we did a radio lesson, a TV lesson, the WhatsApp free conference call, and all others that we did during that time. But with this one now, because we have divided because of the enormity and the vulnerability of those students and pupils, so we have divided them into, that's the reason why we divided them into, so that we have a minimum number in the classroom.
What you did then was TV, radio, and WhatsApp. How effective was it? What was the feedback?
Well, we cannot say we achieved it 100%. Reason being that you have to look at the problem of network provider. Some of those downtrodden masses, their parents, none of them don't have an Android phone. So it's the few that can, we just encourage them to get a small transistor. So those who cannot have access to the Android phone, let the parent have transistor. We send it through the parent forum and SBMC so that they pass the message across to some of them. Despite that, we know some of them will not even listen. Even when you are saying, even teaching them in the classroom, some will still be distracted. Not talk of when they ask them to use a radio or use something. That's the reason why we are saying that virtual learning and teaching cannot be replaced by physical teaching and learning.
So you had some stakeholders in that report expecting more, saying that government still can do more. As a teacher, what do you consider the biggest challenge, at the wake of the second wave as schools resume?
Well, all of us are highly apprehensive about the second wave, because when you are looking, even you look at what we had in Lagos yesterday now, about 700 and something. So it gives us a lot of concern. Though in Lagos, majority of people in Lagos are natural lawbreakers.
How do you mean?
Fine. They don't play the game according to the rules. If you are going now, if you see there, you see many people that are not using masks. Even the transporter that they said they should not carry more than half of their of their passengers. They are overloading. But you see people will not use face masks, everything. You see the contact will be so close that they don't even observe the protocol of COVID-19. So we don't even know any of the people that has entered the bus that is carrying the virus. Aside from that, some people are asymptomatic. You won't know. They will look hale and hearty, but they are carrying something. Immediately they infect you. If they are not using or they are not observing that protocol, you just find out that they will infect many people at random. So in Lagos, everything is just like they have just turned everything to Banana Republic here. So the government needs to step up the action of the enforcement of law.
So let's talk about the role of the NUT in all of this. What is the union doing in driving compliance among teachers? There are reports of certain teachers coming into school without their masks on. Some of them remove them while they're teaching, and even among students.
No, well, I beg to disagree. Because our people, we are the agent of an enlightenment campaign. We are the agent of a mobilization and socialization of others. We educate others to do that. Though in every 12 there must be a Judas. No doubt about that. I'm not saying that there will be one or two people that are not doing that as planned, but it's normal in the society. Even in a perfect society, we still have some people who are deviant. So, but the majority of our members, because they are old, and they know, some know their condition of their own health, so they will not like to joke with their health also. That's the reason why they are clamoring that, please, Shama, they should make sure that what is necessary to be provided for them to be used in school should be done.
So the union is relying on the assumption that your members are going to be responsible. What I'm asking precisely is if there is, a measure, or rather a method of enforcement that ensures that teachers comply. Because it is one thing to say, oh, they are old, some have underlying ailments, we expect them to do what they know. But that hasn't been the case. You just mentioned that Lagos is a lawless place. So you don't expect people to do things just because it is right or because they've been instructed to do it. My question is, are there structures in our schools that enforces compliance and regulates
we have school organogram. The school organogram is there. The head of school, followed by the assistant or the vice principal of the school, the HODs are there. Down ladder there. So for every thing you do, you take responsibility for it. As a head of school or a principal, if such thing happens, you take responsibility for it. And if the HOD is with the other people in the department and one of them is not complying, then the HOD take responsibility for that thing. But I know that my people are highly disciplined. And as I've told you, I want to assure you, if you see anybody that is not using that thing, it's not a member.
All right, but what we have noticed is that there are more compliance in private schools than in public schools. But I want us to pay attention quickly to the school readiness template for state level. Ensure schools have one manned entrance and set up a screening point for temperature screening, including hand hygiene facility at the entrance of the school and other strategic places. Would you say that this is relevant across board?
I would say it's relevant across board because it's only those schools that are well fenced that one can be applicable to. We still have some schools that are complex schools that are not having major fence. Just so that people will come in from different directions. But the strategy we now employ is that if it's a complex school, we try to create a barrier and we post some non-teaching and some teaching staff to monitor when they are coming in with the infrared thermometer and everything, so that they take charge of that. If they cannot take charge of it in totality, at least it will curtail a lot of it.
And did you mention the fact that wash facilities have been supplied during the first wave? So we expect that all schools have the soap, hand sanitizers, and the rest.
Yeah.
But for the face masks, do students bring that from home,
Yes.
or government also supply it to them?
No, the government has given during the first wave, but we expect the parents, through the discussion we had with the parent forum and school-based management committee, to tell them within the community. It's not something much. Some of them do buy Ashwebi that is having when they buy it very newly, part of it, when they sew it, some of that is left, that is not so, can be cut and use it to make face mask, at least 3 for those children, so that they can be alternating it. Not that they'll be wearing one face mask from Monday through Saturday or Sunday.
What structures do we currently have in our schools that provide for prompt response in cases of incidences of an infection?
Yeah. There is an arrangement for we have the NCDC. Okay. They have the local. I forgot the name of that local something. Okay. Within our local government area, so that immediately you observe. First thing is that we have created a room, which is called isolation room. Okay, in all of the schools? In all of the schools. So that child, when you notice that it's having excessive something, you remove that child and put that child in that room before you put call across to the agency or to the local government education authority or to the district headquarters, whereby they will direct the head personnel that will quickly come and attend.
So if a child comes to school now with very high temperature, do you ask the child to go back home, or you send the child into the isolation room?
No, we not ask, because by asking him or her to go back home, we are not helping the matters, because it's still part of our pupils and students. So we have to isolate first and call the head captain to make referral services.
There's an interesting provision here in the readiness template, according to the Federal Ministry of Education. Ensure parents submit the field COVID-19 testing consent form for all children. Have you heard about the consent forms in schools?
Well, we have heard, but I don't think we have practiced that one in Lagos. Maybe they are practicing it in the private schools. You know, as I've told you, majority of those people that are in public school, they are downtrodden masses. Some of them are not so literate, some of them are not so well versed. But if you see those people that are doing that, you see they are in the elite class.
Interesting. So our schools as they are now, with the shift system, we expect that we're not having a full capacity in all of the classes,
Yes.
in all of our classes,
Yes.
and indeed that there is cross ventilation
Yes.
while the classes are on. But let's talk about your interaction with the students, and how learning has evolved at the wake of the COVID-19 crisis. We're told that UNICEF, for instance, recommends that schools be open because continuous locking down of schools would have a terrible impact,
yeah.
on the coming generation. But how inspired to learn, how energetic and ready to learn? I'm talking about, the mindset of the children right now. What are your observations, as a teacher?
Well, yesterday was the first day of resumption. You cannot have total appraisal because they will still be settling down. We can do all this appraisal after 1 week of resumption.
But what about the turnout of the students from yesterday?
Yes. Well, it's not total, but some. And those places I visited, majority of the pupils were in the school.
All right. So it is not normal not to have all of the students.
Yes, because part of those reasons why they said school should not be closed perpetually is that the first time we left the school in March, before we resumed back, in October, we found out that 13,000 students did not come back to school.
After the first lockdown?
After the first lockdown.
Are you for real?
Yeah.
In Lagos?
In Lagos.
13,000?
13,000. 33,000.
33,000?
Yes, not 13, 33,000.
Did not return at all?
Did not return back to school. So either some of them have gone out of the state, some have gone back to their villages, some have even engaged in marriage and all those things, early marriage. So we just found out that, and some of them will not come back to school. Because I had one boy, they are not to do school again, Jerry, and they go, they are asking, the colleagues are, what are you going to do? We're going to collect money at the junction. Can you see the irony of life?
And that has been the concern of UNICEF, saying that if we continually lock the schools, the burden of out-of-school children
will be higher.
And all of the efforts and gains that we've made in the past years are going to be recorded.
It's going to be lost.
It's very terrible. But let us engage government now. Let's talk about what you expect the Lagos State government to do for the schools, at the wake of the second wave.
Well, we, as part of our advocacy, we have said that the Lagos State government should step up those materials, the PPE.
The PPE. What are these PPEs for teachers, for instance?
Yeah, it's what is applicable to the pupils that are applicable to the teachers.
Okay.
Like the soap must be adequate. It's not that they have used this one, it has finished. They are still waiting for the supply. The supply must be readily available. Then the ambient sanitizer, then immediately the school notice that there is problem with the prompt attention should be given to the repair of the supply of water. If it is going to be a major one, maybe they can get tank and use a tanker to be dropping water inside that so that they will start to use that one pending the time they will do the repair. Majorly, the PPE should be step up and allow it to be readily available and functional.
Are you saying all of our schools in the Lagos State wing have water?
Well, as at the last something, the report given to me from all my local branches showed that they have water. Those that are not having all those things, they have the tank reservoir that water is being put into, which they use to supply those things.
So we hear that NUT has called for a NEC meeting by Thursday.
By God's grace, I'll be there.
What do you know what you have on the agenda and what is expected to be
we
discussed?
don't know yet. But when we get to that place, but I know the issue of a resumption vis-a-vis COVID-19 second wave is going to be part of the agenda. So coupled with some other issues that will come up. But because they will want to report from every state of the Federation.
As it relates to compliance with
compliance.
the directives, we hear that in states like Abuja, Enugu, and Plateau, students who come to school without face masks are turned back home. What is the protocol here in Lagos?
In Lagos, because we don't want, as we have said, we don't want to drive them. Being the first day of resumption, what we did is to ask all the head of schools to put call across to the chairman of parent forum yesterday to make sure that those who came to school today without the face mask, if they are coming tomorrow, they must come with their face mask. If they don't come with their face mask, we may not allow them because we don't know where each of the students and pupils have traveled to.
Some of them without face mask were allowed yesterday.
They were allowed. Some of them were allowed. But being the first day of some sure that we didn't drive them back. You know, when you drive them back, they may think that holiday has continued. They won't bother to come to school. So that's the reason.
But an easier thing would have been to just, make face masks supplied in excess in all of our schools. Is that a very difficult task?
Well, that one is left for the government. You see, in some advanced country, the projects, the government doesn't need to do the projects. They're supposed to look at look at the number of students in various schools. So they give to the school manager, go and produce this and give to your children. Then if they come there and none of them is having it, then they are liable. But everything is being centralized here in this country. Everything is being centralized. That's the reason I want to thank the Honorable Commissioner for Education. What she did for the secondary school when we wanted to resume for the first phase. They give them, they look at the accumulated running costs, they put everything together, they increase it, they added some money to that. Okay, take this money, go and prepare this, prepare that, so that as you are resuming, when we don't want any complaint that you don't have this or don't have that. And very fantastic. That's the reason why we are having if you look at the coverage of your correspondent, Sharon, when they went to school, you see schools with a washing hand basis. It was not done by the government, it was done by the school manager because they believe that is what is necessary. They don't want to run foul of the law. But if you are still doing it centrally, it is then you say that the supply has not gone to this, the supply has not gone to that.
What form of trainings have your members had, in recent months as regards, managing the new normal, teaching in the new norm? Yeah,
we had series of training. For instance, UBEC and SUBEB, they had a piece of training on how to, because it is not enough for you to provide PPE. You must train people on how to handle the situation, and that was the training that was put in place before we resume after the first wave.
Absolutely. We'll take a break now. When we return, we'll open the phone lines and get a feel from people, particularly parents who sent their children to school yesterday. We want to find out what the compliance really was like at various schools in Lagos. We'll also be joined by a medical doctor who will help us put this in better perspective. Stay with us and don't go away.
At TVC News, wherever the big news story is happening, we're geared up to break it. TVC News, first with breaking news.
And thanks for staying with us. NUT Chairman, Lagos State Wing, Adesina Adedoyin, is my first guest on the program this morning. Thank you so much for staying the course on the show, and we wish you the very best as the schools open once again, and we're looking forward to more compliance, across board.
Thank you.
Thank you so much for coming. All right, so let's talk more about some of the very baffling figures. The PTF chairman yesterday, while giving his remarks, noted that 1 out of every 5 persons tested in Nigeria last week turned out positive. That's about 20% of all of the tests conducted. We're told that in Africa, South Africa, Ethiopia, Nigeria, Algeria, and Kenya now account for 76% of all the cases in the African region. And we're also told that Nigeria, as we speak, has moved up to the 3rd position in the highest cumulative caseload, but remains 2nd for new cases and 5th highest in cumulative deaths in the African region. So it's a big question as regards how Nigeria as a nation is responding to this, and indeed if Nigerians are paying attention to the figures. Let's offer a medical perspective to this conversation this morning. I'm joined by Dr. Oluchi Ubani, public health practitioner. Thank you for joining us on the program this morning.
Thank you so much. Good morning.
Doctor, good morning. What do you make of the figures? Just last night, NCDC reported 1,617 new cases, shooting our numbers high to 112,004. Prior to this time, there's been a lot of talk about herd immunity, the fact that if more people contract the virus, then there's possibility that more people are going to grow immunity against it, particularly looking at the high rate of recovery that we've recorded in the past. How do you react to this?
Okay, compared to last year when COVID-19 was in, Nigerians got to know about it, there was so much care and there was so much precaution. So I think as the year rounded up, the amount of awareness, people were no more taking it as serious as it was last year. In fact, currently, people from the news and interaction with people, they are not so, they even still have that belief that COVID-19 doesn't exist at all. And they no longer believe what the figures, whatever figures are being said. So more testing, like we've always canvassed last year, more testing should be done, more awareness. People need to take precaution because it's spreading. More people are dying. It's even coming closer. People are waiting till, it gets to a family member I know, or it gets very close around the corridors of where I stay before they take precaution. So it's happening. It's going on in Nigeria. The numbers are increasing because people were relaxed. You have people organizing parties. You have people going to crowded places. People don't even wear nose masks. They now leave it on their chain. They just hold it as a pass to go into malls and the rest of it. And then when they are in, they remove it. People don't take that precaution any longer. And the most frightening part is in this part where children are going back to school. Children need to be sensitized. Teachers need to be sensitized. Teachers should be equipped. Okay, what symptoms will we see? We have to re-inform the public. We have to resensitize the public. Places of worship, leaders of places of worship needs to be re-informed so that they will talk about it, because there's no longer, people are no more obeying the set guidelines. People are saying, oh, no lockdown. They see it as a joke when the government says there might be a lockdown soon or so on. People fight against this. People are not seeing this as serious as they saw it last year. So I think more sensitization should be done because these numbers are increasing and it's getting closer. People should be aware. You should be aware for yourself, for your family. People shouldn't object to get tested. They shouldn't object to that. In fact, every practitioner right now, when you come in with certain symptoms, you are saying you're being treated as a potential COVID-19 patient because precaution, they say prevention is better than cure. Look at the beginning of the year, we were given the sad news of the death of some doctors. Probably we can't say we are perfect, but what if such situation can be avoided? So I think more sensitization should be done. The numbers are truly increasing. People are getting infected daily. So even if you're in a taxi, you should put on your nose mask. You're in a bus, you should put on a nose mask. No matter where you are, you have to put on your nose mask, wash your hands regularly, have your hand sanitizers, maintain social distancing because it's increasing daily.
Dr. Ubani, at what point do you think a second lockdown will be considered imminent?
When people refuse to adhere, when we see that people refuse to adhere to what is going on, when the cases keep getting scary, we shouldn't wait till we get into billions for us to take action. Because after the lockdown, people stayed in. There was not much increase. Because people say, oh, look at it, could you quantify? People in the public, they are not there. They're not in the hospitals. They're not there with the research to know what's going on. So if people don't adhere, if the cases increase, we don't want deaths. If deaths increase and people don't adhere to instructions, and I think every leader, whether those in charge of transport companies, those in charge of schools, they should have meetings and address their staff, address their association members. Oh, don't carry more than this amount of people in your taxi. Don't carry more than this amount of people in your keke. Don't carry more than this amount of people in your bus, and ensure that your passengers put on nose masks. Oh, in the market union should form a kind of a way to curtail the way the market is crowded. People can plan, think in different places, in your offices, in schools. The unions, those in charge should plan, because if things get higher than what we can control, we have to put people off the street, because the lesser people are off the street, the lesser.
Absolutely. These conditions are also perhaps the reasons why it's been difficult to comply is the economic burden that these conditions you have highlighted is placing on the people. But let's not talk about that for now. Let's talk about what people who have this virus need to do. We hear that the hospitals are becoming burdened by the increase in numbers, and they might get to a point where health practitioners will have to decide who they can admit and who should stay back at home. For those who have contracted this virus and who, for one reason or the other, have been asked to stay back at home, what is expected of them? What do they need to do now?
So I'm going to talk based on the part of the medical professionals and also on the part of the patients that have been asked to stay back at home. The medical team that has asked this patient to stay back at home should do proper follow-up so that they are always in contact with these patients, guiding them, encouraging them, talking to them. Then the patient on his or her part should know that this is not a death sentence. This is not a death sentence. So follow the guidelines and you'll be fine. Maintain social distancing, tell friends. You should even be an advocate. I've seen many people that, by God's grace, they've been able to overcome COVID-19 and they're now advocates. So you should be the one spreading the news, telling those around you. They say charity begins at home. You start at home, maintain social distancing. You talk to your family members, you tell them, do this, be an advocate. But the healthcare arm should follow up on these patients as much as they can.
Let me hold you briefly, Doctor. Let's take a call from Kaduna. Good morning, Abdul.
Good morning, Mr. Nifemi. Good morning.
Good morning to you. Welcome.
Yeah, good morning. I just want to make contribution regarding the topic.
All right, go ahead, please.
Okay. I would like to just itemize 4 to 5 points in brief, please, if I'm opportune to highlight it regarding the issue of the second wave spike.
All right.
Okay. First of all, I look at the government. The government are not doing well. We've seen some of the weddings, not being biased, by some government officials or persons in government and the crowd and all that. So if they are doing this, what they expect we that are looking, because everybody look up to their leaders, what to do about it. And the second thing, I see that the government are not using this, they are just centralizing it. Like the PTF, is federal government. The states are not showing more, concern, more, trying to work, collaboration, trying to work. And they should adopt some local approach. Local approach in the sense that many people, those people at the very lower level, the grassroots level, they need to be sensitized even in their language. So what effort are they making? Either trying to recruit people, go to ward heads, go to chiefs, go to their, like here in Kaduna, like we call our chief Sarki, you go there and have to use local language so that they could be able to tell their people. The enforcement is not there. Kudos to TVC. I like the, continuous sense. Even I just watch your view. It's all COVID, now COVID and all that. Probably journalists hang out with COVID. So they should use local approach to, to try to, enlighten people. People don't believe, even people who are educated. The worst of it is that even educated people do not believe in this. And it's so much of those people who are not educated. And the other point I would like to make is that there should be total enforcement. Like you see all these taxis and all that boxes carrying people, overloading people. You can see what's going on. But though the governor is trying, but they should try to be strategic. They should mark the task force at strategic locations, and so that they'll be able to awaken the minds of Nigerians that this thing is real. And the other thing I would like quickly, if I'm given the opportunity, is that they should please suspend flights from those high-risk countries. Is it the UK or South Africa straight? They should suspend the flight. They should not play politics with this. because the strain, according to what the information we get, are coming from those countries, are not like the first one that we are not being much infected.
I think you made a point, Abdul.
Please.
Thank you so much for calling. Again, it's the economic impact. You take UK, for instance, and you want to find out how much value, how much economic value, transaction between the two nations are bringing, and you begin to wonder if it is worth it to totally shut it down, or perhaps just tighten the policies of ensuring that we don't again import the new variant. Dr. Obani, I'm back with you. Schools are resuming, and parents now have to send their children to school. UNICEF says we can't keep the children at home for too long. I just spoke with the NUT chairman in Lagos, who mentioned that 33,000 school children did not return after the lockdown last year in Lagos. And if that happened in Lagos, you can imagine what would be happening in northern Nigeria that has perhaps the highest number of out-of-school children. What are the basic health facilities that schools require, and what should parents look out for?
Okay, so schools should ensure, because I listened to when the NUT chairman was talking about students not coming or pupils not coming to school without their nose masks and they send them back. I don't really go with that idea. I think if schools should provide at least that initial face masks on that first day. You can get the school uniform, the waste material from the school uniform, and you contract those schools that can afford it. You give them face masks. Every pupil should have their face mask. They shouldn't see it as a punishment. You give them, you also educate the guardian that is coming, or at the gate, someone is coming, it's not, you give the person a face mask. At least that first instance, you give a face mask to the guardian, to the child walks in and you tell them you have to always come with your face mask. So you're leading by example. They should also have a clinic, a mini clinic with equipped staff. The teachers also should be trained so that you know the symptoms. When you have a pupil that is quiet in class and feeling feverish, you should also raise the attention of the patient and of the parents, and also proper check. Those in the clinic shouldn't just say, oh, these are children, what can they do? You have to be properly covered and kitted. There should be a medical kit. Then there should be places at the entrance, according to the guidelines given by the Ministry of Education. At the entrances, every entrance and exit, there should be places where they can wash their hands, flowing water and soap to wash their hands. And you also have hand sanitizers. You should have hand sanitizers. Those that can afford it, on the entrance to each classroom, they wash their hands. Then children should be educated during assembly hours, during recess. They should be educated to avoid more social distance. In fact, they should be able to notice, oh, my fellow pupil has been having feverish, my fellow pupil is not acting normal, and report to the teachers or to the nurses. And the nurses shouldn't hesitate to involve the parents and the nurse medical professional care. I even actually advise teachers or schools, owners of schools, should partner with certain government hospitals so that if there is a pupil that needs urgent attention, they should take it to them. Because some parents, you don't know how they are faring. Some parents might not comply, but with their consent, or some parents, because of funds, they can't really take care of that child. With their consent, then fully aware, you can now work with the hospital. That's essential.
Absolutely.
COVID-19 can affect even children and the rest and everyone. So they should take proper care. They should even on the walls, when students are facing the board, there should be posters, maybe in cartoon characters, letting them know what COVID-19 is about.
All right, let me hold you very quickly, Dr. Oluchi. Abdul has called in from Lagos. Good morning, Abdul.
Okay.
Well, you have to turn down the volume of your TV.
Hello?
I can hear you. Please go ahead with your contribution.
Okay. What I want to say is this. Concerning the COVID. Hello?
Go ahead, please.
You see, it's not a matter of wearing the mask. I want the authority complaint to make it clear to people so that it's not a matter of wearing mask, but wear it properly. Because some group of people, we see them on this, they will leave the nostrils. They only cover the upper lip, leave the nostrils. which means it's more or less they are not even putting it on. Then the other group of people, they'll cover their job, even the everything, the map and the nursery is open. So the advocate should be just wear the mask, but wear it properly. That's my contribution.
Thank you, Abdul. Very critical. Thank you so much for that important information. Dr. Oluchi, we are told that the vulnerable people are those who are elderly and who perhaps have underlying ailments. So how do parents interact with their children who have gone to school? You know, how do they interact with them on their way out to school and when they are coming back with the mindset that being younger people, they might be asymptomatic and might be transmitting the virus?
Okay. So that a certain age vulnerable does not mean, okay, they are higher risk. But that does not mean it cannot affect all age. So if a parent is well informed, when your child returns from school, before the child gets into the house, you make the child wash his or her hands outside, and probably school bags and uniform. If you're living in your private compartment, but if there's a place, oh, okay, you can drop it in this pocket, the rest, because you don't know who the child has interacted with, and the child goes straight, has a shower before other interactions. The child understands. Once the child understands and keep doing it, the child, even when you don't remember, the child follows that protocol. And if that child sees you doing it, also you as a parent, when you go out of the house, you go to the market, you go to the mall, and even if you go to church, you come back and you have your hands washed before you step in, the child will follow suit. So lead by example. I know it might not be, it's not our regular lifestyle, but we have to, they said prevention is better than cure. We have to try our best to keep it. Then also in school, we also inform the child. In schools, I believe the school should try and do something like a little write-up for parents or guardians. And also take notice of those that might not be literate enough to understand what you have written down. You have to look for a way to convey this message to them. And also in school, it can be like a game. Instruct them when they go out to eat themselves or when they go out to play and they come back and they are forced to wash their hands. Children are very smart to pick up whatever they see. They would like to practice that. If you don't have the availability of the running water, you can get a bowl, they wash their hands, they throw away the water, just find the way around it. That would be the best event, and that will inform your child. Now for the nose masks, it's not just all about the nose mask, it's also about maintaining social distance. In the class, if they can stick 1 meter apart, your children might find it difficult to place the nose masks. When we are making nose masks for children, I've seen when most patients are coming, and I noticed that the nose mask is very tight, the child is very uncomfortable. So if you can take your time, you can even get the nose surgical mask, the protective mask for them. If it's expensive, you sew the nose mask in such a way that it's big enough, and the band, the sling for the ear shouldn't be too huge, it should be slim enough so that it's easy for them to put on, and you let them know that they should cover their nose. Most of them that use glasses, they should ensure that the nose mask pulls up and their glasses sit on the nose mask so that when they are talking, the vapor doesn't cloud the glasses.
We'll talk more about the nose mask very shortly. How long can it be worn? Some wear nose masks. It's just that they wear it for a month and don't wash it. What's the risk involved in that as well? But let's take Okorafo's call from Arochukwu in Abia State. Good morning, Mazi.
Good morning, Mr. Nife. Good morning, Dr. Oluchi. Good morning. You see, the issue, what we are facing today is that the awareness is very, very slow. Because I was expecting that the local government authority could have used the town criers, the youth, at least let them do this job. Now, the issue of the schools reopening, well, there's nothing about it. Now, the question I want to ask Dr. Oluchi, Doctor, now, you have seen our universities today. If you go to all the Nigerian universities, whether private or federal or state, a room meant for 4 students, they are up to 10 or 15 in that very room. Under this condition, now, what are you advising the federal government or the state government or the people that own this university on what to do on this type of grant? And under such situation, now, you see the lecture room you go now, a lecture room meant for maybe 50, 60. They have up to 400 or 300 students attending a particular course. Now, under that condition, what do you expect all these universities to do? That was notwithstanding this issue of water. Do you know there are some states staff don't run? Because staff don't know, how do they cope? Because I went to it was a little thing that I must go and buy this paper with one paper once that's just like I don't know that it will help me just like that water. I said, look, it's not everybody can afford it. So that is issue now because federal government and our schools now, what do we do? Because it's very, very important. And the worship centers, people are ignoring it. I agree, God is the ultimate. Me, my own is God first before another thing. But the worship centers, they should help us. Thank you very much.
Thank you, Mazi, for your contribution. So the disposable mask, Dr. Oluchi, sells for about 100 naira. So some buy them, use them, perhaps just keep it in the car, pick it up the other day and use it. Other people use the ones made from normal cloth materials and use them for long. How long should you wear a mask? And when do you need to dispose it or wash it?
Okay. So you shouldn't wash the disposable masks. Like the name goes, disposable. After you're done with it for a day, you hold it by the slings.
Okay, you can use one all through the day.
If you drop it, once you remove it, it's not safe to put it back on. It's believed that once you put on a mask and then you're using it for that day. I don't know how long. Let's say some people work for 8 hours, 10 hours. You're using that one for that day and then remove it. You should trash it. In fact, if you can burn it, you burn it. But for the cloth marks, you can wash it and sun dry it. Don't hang it in your bedroom and let it to dry by the air in the room. No, you should sun dry it. It's always safer to sun dry it. You can have, for those that can't afford the disposable masks, the cloth masks is more economical. So you could get them as much as you can, or you get your tailor to sew as it suits your nose. And remember, the sling shouldn't be so big so it doesn't cause pain behind your ears. So when you are done with them, you wash them. You shouldn't wash them with the rest of your clothing. You should wash them separately and then you sun dry them. So the cloth mask can be used more than once. But after one use, you wash. After a particular day you're done with it, you wash. But the disposable mask, like the name goes, it should be thrown away in the trash can or burnt after use. Just one. The disposable mask shouldn't be used the next day or washed to be used the next day. That's not its purpose. It's to be, once you're done with it for that day, you throw it away. And you don't just litter it. Don't see on the road walks, on the car parks, when people get to their car, they drop it. No, it's not right.
All right. It's a good place to live in.
If you forgot to throw it away,
it's a good place to live in. Public health expert, Dr. Oluchi Ubane, thank you so much for your time this morning.
Thank you.
All right, keep safe. Keep safe, everyone. Remember to wear your masks properly and do all that you have been asked to. Wash your hands frequently, get the sanitizer, and ensure that you keep safe distance from everyone you meet today. We'll be back tomorrow, God willing, with another one. I am Nifemi Oguntoye. God bless Nigeria.
At TVC News, wherever the big news story is happening, we're geared up to break it. TVC News, first with breaking news.